Neha Pagidipati and Mike Gibson coming to you talking about LDL. Where do we set the new rheostat? Neha, we saw from one of the recent trials presented here, Easy Pave, that for one of the first times we have randomized evidence that lower is better. Of course, we always had epidemiologic evidence, we always had subgroup evidence, but they randomized people to achieving, an LDL of say 70 versus 55, and 55 was better. I would add with a p-value of 0.002. And what we do know from a lot of the epidemiologic data and a lot of the data from trials is that lower is better. And we don't really have any safety concerns that have really cropped up. And anyhow, the guidelines just came out and they stuck with the 55 and 70 milligram per deciliter guideline recommendations. But just before the guidelines came out, we had the results of Vesalius, where people hit an LDL of 45. So, my question for you, Neha, is where do we fit that new data in? What is your kind of thinking about an LDL of 45 and new targets? Where should we be?
Yeah, thank you so much, Dr. Gibson, and thanks for having me. I mean, this is an excellent question, and I think the guideline writers have done an amazing job of bringing the guidelines to where the evidence is and where many of us are currently practicing, much closer to the more aggressive guidelines that the Europeans have. And so they did an amazing job. But as always, the data is continually coming out, and as soon as you write a guideline, there's something new that comes out, and
It's
even
almost as though the guidelines create new data.
yeah, exactly. And Doctors Blumenthal and Morris wrote a beautiful editorial in circulation about this that like, we just missed the Vesalius data. But you make, such an excellent point. Lower is better, and even lower is better than lower. So there is no lower limit. I mean, my patients ask me all the time, don't I need LDL cholesterol? And is there a danger of my LDL being too low? And I think over and over we've seen that all that happens when your LDL is too low is that you die less and you have fewer events. And so the Vesalius data, I do think in the next iteration of the guidelines will push things lower, as you said. Right now, if you if you have secondary, if you're a secondary prevention, you've had, an ASCVD event, but you're not at quote unquote very high risk. As you mentioned, the goal LDL was 70 if you're at very high risk, which honestly is the vast majority of patients. You just need an additional risk factor. That's less than 55. And here, I think what will happen is Vesalius is showing us that we need to be less than 55. Even if you haven't had a prior event. So if you have evidence of atherosclerosis, you've had prior, PCI or CABG, or you just have evidence on imaging, even if it's subclinical and you're asymptomatic, or if you have high risk diabetes, meaning that you've had diabetes for over 10 years, or you're on insulin therapy, or you have microvascular disease, all of these patients did better when their LDL was less than 55, as you mentioned, hitting a median LDL of 45. So I do think that the next iteration of guidelines will push us even lower, even earlier in kind of the trajectory of the disease.
But Neha, what do we do? I don't know when the next guidelines will come out. It seems like it takes a few years, five to
Yeah.
7 years or something. What do we do in the interim as a doc?
Less than 55 for certain. I mean, there's
Right.
no question in my mind if your patient has significant atherosclerosis, and the guidelines even comment on, calcium scores of 0 to 100, you still should be pushing quite low. If they have elevated risk factors, even lower. But basically, for all of these patients who are quote unquote secondary prevention, they've had an event or they have clear atherosclerosis. In Vesalius, if their calcium score was greater than 100, they were entered into the trial. All of these patients do better with an LDL target of less than 55.
Well, we all know there are societies out there, hunter-gatherers, who have LDLs of 30 to 45 doing just fine.
Exactly right.
So, and there's no evidence of cognitive impairment with low LDLs. As someone with a high Lp(a), I keep my LDL at 19. So I do what I say.
Good.
Drop it down as low as you can,
That's exactly
as
right.
you tolerate it. Neha, thanks for weighing in today. Thanks for joining us.
Thank you so much for having me.